If you've noticed a change in your intimate life after 50 or 60, especially reaching climax, but seeing little to no fluid release, there's something important you need to understand before worry takes over your mind. Because what you are experiencing is far more common than most men realize. And more importantly, it is not automatically a sign of lost masculinity, aging failure, or the end of your sexual health. Let me be direct with you from the beginning. This is not a collapse of your body. It is a signal, a message. And once you understand how to read it properly, the fear starts to lose its power. Imagine this moment for a second. The sensation is still there. The build-up, the peak, the release inside your nervous system, the pleasure that feels familiar, everything seems normal. But afterwards, something feels missing. No visible fluid, or maybe just a few drops. That gap between expectation and reality can feel unsettling. For many men, it triggers silent panic. They don't talk about it, not even to their partners, and instead carry this question alone. What is happening to me? Now let's slow this down and understand it properly the way we would in a clinical consultation. The first thing I want you to separate in your mind is this. Climax and ejaculation are not the same system, even though they usually happen together. Climax is driven by your brain and nervous system. It is electrical, sensory, and deeply tied to pleasure pathways. Ejaculation, on the other hand, is mechanical. It is a coordinated physical process involving the prostate, seminal vesicles, ducts, bladder neck, and pelvic muscles. In most of your life, these two systems have worked in perfect synchronization. But like any coordinated system in the human body, timing and mechanics can shift over time. To understand this better, picture a highly organized biological sequence. The testicles produce sperm continuously. The seminal vesicles contribute the majority of the nourishing fluid. The prostate adds additional secretions that support mobility and protection. All of this is stored and then released through a network of ducts during climax. At the exact moment of orgasm, the brain sends a strong signal through the spinal cord. This triggers rhythmic contractions in the pelvic muscles, and at the same time, a very important valve at the bladder neck is supposed to close tightly. That closure is critical because it ensures the fluid moves forward, not backward. When everything works perfectly, it feels effortless. But when something in the system changes, even slightly, the outcome changes too. And that brings us to what medicine calls dry ejaculation, or anejaculation with preserved orgasm. In simple terms, it means you still feel the orgasm, but the fluid output is reduced or absent. Many men describe it as an empty release. But that term can be misleading because nothing about your nervous system's ability to feel pleasure has necessarily been damaged. One of the most common causes behind this condition is something called retrograde ejaculation. To understand this, imagine that small valve at the bladder neck acting like a gatekeeper. During climax, it should close firmly so that semen moves forward through the urethra. But if that gate does not close properly, the path of least resistance changes. Instead of moving outward, some or most of the fluid flows backward into the bladder. You still experience the full neurological orgasm, but the visible ejaculation is missing because the fluid went in the wrong direction internally. Many men discover this accidentally. They notice that after intimacy, their urine looks slightly cloudy. That is often the first clue that semen has mixed with urine inside the bladder. What is important here is not to panic, but to understand why this happens. In many cases, it is linked to medications that affect smooth muscle tone, especially drugs used for blood pressure or prostate enlargement. In other cases, it can occur after prostate or bladder surgery where delicate nerve pathways have been altered. These procedures are done for valid medical reasons, but they can sometimes affect the reflex that controls that bladder neck closure. I have seen men sit in my clinic completely convinced that something is broken forever, when in reality the issue is mechanical, not degenerative. One patient, for example, had undergone a successful prostate procedure. His concern was not pain or dysfunction in daily life, but the absence of fluid during climax. Once explained that the pleasure pathway was intact and only the directional mechanism had changed, his anxiety dropped significantly. That emotional shift is often the first real step toward recovery of confidence. But retrograde ejaculation is not the only explanation. Another important cause lies in the physical pathway itself, what we can call ductal obstruction. In this situation, the production of fluid is still happening normally, the testicles and seminal vesicles are functioning. The issue is not production, but delivery. Think of it like a plumbing system. If the pipes are partially blocked, flow decreases, even though the source is working perfectly. These blockages can occur due to scarring from past infections such as prostatitis, or in some cases due to small calcifications forming within the ducts over time. The symptoms here are often subtle. It does not usually happen overnight. Instead, men may notice a gradual reduction in volume over months or even years. Some describe mild pelvic discomfort during climax, while others simply feel that something is less forceful than before. The important point is that this is not always permanent. Depending on the cause, medical treatment can reduce inflammation, and in certain cases, minimally invasive procedures can restore normal flow. The key is proper evaluation rather than assumption. Then there is a third major factor that often gets overlooked because it is less mechanical and more systemic. Hormonal decline, particularly low testosterone. Testosterone is not just a sexual hormone. It is a regulator of the entire reproductive environment. It influences libido, sperm production, prostate function, and even the fluid contribution from accessory glands. When testosterone levels decline significantly, the entire system becomes less active. The result may start subtly, reduced fluid volume, but over time, it can also affect desire, erection quality, energy levels, and emotional balance. Many men assume this is simply normal aging, but clinically that is not always accurate. Some men maintain strong hormonal profiles well into later decades, while others experience a sharper decline that is treatable. The important distinction is that this is measurable. A simple blood test can provide clarity. And if deficiency is confirmed, carefully managed treatment options exist that can restore not only sexual function, but overall vitality, mood, and energy. However, there is an important responsibility I have as a physician, and that is to make sure you do not ignore warning signs. While most cases of dry ejaculation are benign and explainable, there are rare situations where it can be associated with neurological conditions such as diabetes-related nerve damage or disorders affecting the spinal pathways. In very rare cases, it may be linked with more serious urological conditions. That is why sudden onset, especially when combined with symptoms like pain, blood in urine or semen, fever, or numbness in the genital area, should never be ignored. These are not situations to wait and see. They require proper medical assessment. What often gets overlooked in all of this is the emotional impact. For many men, ejaculation is not just a physical event. It is tied to identity, confidence, and self-perception. When that changes, even without loss of pleasure, it can create anxiety. Some men begin avoiding intimacy altogether, not because of physical limitation, but because of fear of embarrassment or misunderstanding. This silence creates unnecessary emotional distance in relationships. And here is something I want you to understand very clearly. Your ability to experience pleasure, connection, and intimacy does not depend solely on the presence of visible fluid. That is a learned association, not a biological requirement for satisfaction. The nervous system responsible for pleasure remains intact in most of these cases. What changes is the output pathway, not the experience itself. The first step forward is not panic and not silence, but evaluation. A proper medical history, physical examination, and simple laboratory tests can usually identify the cause. From there, treatment is highly individualized. Sometimes it is a medication adjustment. Sometimes it is hormonal correction. Sometimes it is reassurance alone, which is more powerful than most people realize. What matters most is that you do not interpret this as loss. It is not an ending point. It is a physiological variation with explanations that modern medicine understands well. And when understood correctly, it becomes manageable rather than frightening. Continuing from where we left, the most important thing to understand now is not just what dry ejaculation is, but how we actually confirm the cause in real clinical practice, because guessing in medicine is what creates unnecessary fear. When a man comes into a urology clinic with this concern, the first goal is not to assume anything serious, but to carefully map out the timeline, the pattern, and the associated changes in the body. Because the same symptom can come from completely different mechanisms, and the treatment depends entirely on identifying which system is involved. The first step is always history. Not just when did it start, but how it started. Was it sudden or gradual? Did it happen after a new medication, after a surgery, after a period of illness? Or did it slowly evolve over months or years? These details matter because the body rarely changes without a reason. For example, a sudden onset after starting certain prostate medications immediately raises suspicion for a functional valve issue at the bladder neck. On the other hand, a gradual reduction in volume over time points more toward hormonal decline or partial ductal obstruction. The second step is a physical examination, but not in the way many people imagine. This is not about invasive procedures right away. It is about checking for prostate enlargement, nerve function indicators, and general signs of hormonal health such as muscle tone, body composition, and secondary sexual characteristics. These are subtle clues, but in experienced hands, they tell a very detailed story about what is happening internally. Then come the basic investigations, and this is where clarity usually begins to emerge. A simple urine test can sometimes reveal the first hidden clue. If semen is flowing backward into the bladder, post-ejaculatory urine may appear cloudy or contain sperm under microscopic analysis. That single finding can confirm retrograde ejaculation without needing any complex imaging. Blood tests are equally important because they help assess testosterone levels, metabolic health, and conditions like diabetes, which is one of the most underestimated contributors to nerve-related sexual dysfunction. Diabetes, especially when long-standing or poorly controlled, gradually damages the small nerves responsible for coordinating ejaculation. It does not happen overnight. It is a slow process where sensation, timing, and muscle coordination become slightly less precise over years. Many men do not connect their blood sugar history with sexual changes, but in clinical reality, the connection is very strong. That is why metabolic health is always part of the evaluation, not separate from it. In some cases, imaging like ultrasound is used to assess the prostate and seminal vesicles. This helps identify structural blockages, enlargement, or calcifications that may be interfering with normal fluid transport. But what is important to understand is that most cases do not require advanced imaging. A structured clinical evaluation is often enough to identify the underlying category of the problem. Once the cause is identified, treatment becomes highly specific rather than generalized. If the issue is retrograde ejaculation caused by medication, the first step is often a review of the drug regimen. Many blood pressure medications, especially alpha blockers, are known to relax smooth muscle at the bladder neck. That relaxation improves urinary flow but can interfere with ejaculation mechanics. In such cases, adjusting the medication or switching to an alternative under medical supervision can sometimes restore normal function. If stopping or changing medication is not possible, there are certain pharmacological strategies that can sometimes improve bladder neck tone. These are not universal cures, but in selected patients, they can significantly reduce retrograde flow. The key principle here is balance. We are always weighing cardiovascular health, prostate health, and sexual function together, not isolating one system at the expense of another. If the cause is hormonal, particularly low testosterone, then the approach is very different. Testosterone replacement therapy is not something to be taken lightly or used casually. It requires proper diagnosis, repeated testing, and careful monitoring. But in appropriately selected men, restoring hormonal balance can improve not just ejaculation volume, but also energy levels, mood stability, muscle mass, and overall vitality. The mistake many people make is viewing testosterone purely as a sexual hormone. In reality, it is a systemic regulator of male physiology. However, it is equally important to understand that not every man with low volume or dry ejaculation needs hormone therapy. This is why self-diagnosis is dangerous in this area. Some men see symptoms online and immediately assume hormonal deficiency when the actual issue is mechanical or medication related. That is why structured evaluation is essential before any treatment decision. Now, let's talk about ductal obstruction in more detail, because this is often misunderstood. The male reproductive system has extremely fine channels, and over time, especially after infections or inflammation, microscopic scarring can develop. This scarring does not always block flow completely. Instead, it narrows the pathway, reducing the volume that can pass through during climax. Men may not feel pain, and they may still have normal erections and normal orgasm sensation, which makes the problem harder to recognize early. In selected cases, anti-inflammatory treatment can reduce swelling and improve flow. In rare situations where clear anatomical blockage is identified, minimally invasive procedures can be considered to open or bypass the obstruction. But again, these are not first-line treatments for everyone. They are reserved for specific confirmed cases after proper diagnosis. What often gets overlooked in discussions about this condition is the role of the pelvic floor muscles. These muscles are actively involved in the final phase of ejaculation. If they are weak, uncoordinated, or over-tensed, the pressure required for proper expulsion may not be generated effectively. This is why pelvic floor rehabilitation is sometimes recommended. It is not about aggressive exercise, but about restoring proper neuromuscular coordination in the pelvic region. Another important factor is chronic stress. The nervous system plays a central role in ejaculation. The sympathetic and parasympathetic systems must coordinate precisely. When a person is under long-term stress, sleep deprivation, or anxiety, this balance can be disrupted. In such cases, the physical structures are normal, but the timing signal from the brain becomes less efficient. This is why some men experience variability, normal function on some occasions, and reduced output on others. Psychological impact also deserves deeper attention. When men notice a change in ejaculation, the mind often fills in the gaps with worst-case assumptions. Anxiety then creates a feedback loop. The more a man worries, the more the nervous system becomes dysregulated during intimacy. Over time, this can worsen the symptom even when the physical cause is mild. Breaking this cycle requires understanding, reassurance, and sometimes structured counseling, not because the problem is imaginary, but because mind-body interaction is very real in sexual function. From a lifestyle perspective, metabolic health plays a far bigger role than most people realize. Poor cardiovascular health directly affects blood flow to the pelvic organs and also impacts nerve function. Conditions like obesity, high cholesterol, and insulin resistance gradually reduce the efficiency of the entire reproductive system. The same system that supports heart health is also responsible for sexual performance. This is not coincidence. It is shared biology. Hydration, sleep quality, and physical activity also contribute indirectly. The reproductive system is not isolated. It is part of a larger endocrine and vascular network. When that network is healthy, sexual function tends to remain stable. When it deteriorates, sexual changes often appear early as warning signs. Now, one of the most important points I want to emphasize is expectations. Many men assume that sexual function should remain identical throughout life. But biology does not work in absolute terms. It works in adaptation. As the body ages, some parameters shift. The goal of medicine is not to force the body into a younger state artificially, but to restore optimal function within a healthy physiological range. That means if a man has preserved orgasmic sensation, stable erections, and good overall health, but reduced ejaculatory volume due to a benign cause, the focus may simply be reassurance and optimization rather than aggressive intervention. On the other hand, if the symptom is part of a broader metabolic or neurological issue, then addressing the root cause becomes essential for overall health, not just sexual function. Another important aspect is medication review beyond prostate drugs. Antidepressants, particularly SSRIs, are well known to affect ejaculation. They can delay it, reduce it, or in some cases suppress it completely. This does not mean these medications are harmful overall. They are often life-changing for mental health. But it does mean their side effects must be recognized and managed rather than ignored. In some cases, dose adjustment or switching medication can significantly improve sexual function without compromising mental health stability. As we bring all these pieces together, what becomes clear is that dry ejaculation is not a single disease. It is a symptom with multiple possible origins. Mechanical, hormonal, neurological, pharmacological, metabolic, and psychological factors can all contribute. That is why a structured approach is so important. And perhaps the most reassuring message I can give you is this. In the vast majority of cases, this condition is manageable, explainable, and non-dangerous once properly evaluated. The fear usually comes from uncertainty, not from the condition itself. Once the cause is identified, the fear usually disappears much faster than the symptom. What I want you to take away from this is not anxiety, but clarity. Your body is not suddenly failing without reason. It is communicating. And when you listen to it correctly, you often find that the solution is far more straightforward than the imagination feared. Continuing from where we left. Once a man understands the medical causes behind dry ejaculation, the next question almost always becomes the most important one emotionally. Can this actually improve? And can I get my confidence back? And this is where clinical reality becomes far more reassuring than the fear that usually builds in silence. Because in most cases, yes, improvement is possible. And in many cases, function can be partially or significantly restored depending on the underlying cause and how early it is addressed. But recovery is not a single switch that turns on overnight. It is a process that depends on what exactly is driving the change in the first place. If the cause is medication related, then recovery often begins with a simple adjustment under medical supervision. The body responds relatively quickly once the triggering drug is modified or replaced. In these situations, men sometimes notice improvement within weeks because the system itself was never damaged, only temporarily influenced. If the cause is retrograde ejaculation, recovery depends on whether the bladder neck function can be improved or supported. In some cases, medication adjustments or targeted pharmacological support can help strengthen the closure mechanism during climax. But it is also important to be honest here. not every case returns completely to baseline. And yet, even in those cases, what often improves is something equally important: confidence. Because once a man understands that orgasm is still intact and that the condition is not harmful, the psychological burden reduces significantly. That alone improves overall sexual experience far more than most people expect. When hormonal imbalance is the underlying factor, particularly low testosterone, recovery is tied to correction of the hormonal environment. But again, this is not about blindly replacing hormones. It is about careful, monitored restoration of balance. When done correctly, men often report not just improvement in sexual parameters, but a broader return of vitality. Energy levels stabilize. Sleep improves. Motivation returns, and sexual response becomes more consistent. It is not an instant transformation, but rather a gradual realignment of the body's internal signaling system. In cases involving ductal obstruction or post-inflammatory changes, recovery depends on the severity and duration of the blockage. Mild inflammation-related narrowing can sometimes improve with medical therapy alone. More persistent cases may require procedural intervention. But even then, outcomes are often good when the condition is properly identified early. The key principle in these cases is preventing long-term neglect, because the longer a structural issue remains unaddressed, the more adaptation and scarring the body undergoes, which can make recovery slower. Now, beyond medical treatment, one of the most powerful but underestimated elements of recovery is lifestyle correction. And this is where long-term outcomes are often decided. The reproductive system is extremely sensitive to vascular health. That means anything that affects blood flow, such as smoking, uncontrolled diabetes, high cholesterol, and sedentary behavior, will eventually influence sexual function. When men improve cardiovascular health through consistent movement, dietary control, and metabolic management, they are not just protecting the heart. They are directly improving the same vascular pathways that support sexual performance. In clinical practice, I often see that men who commit to improving their metabolic health experience better stability in sexual function over time, even when underlying conditions cannot be fully reversed. The body adapts when the environment improves. Sleep is another critical factor that is often underestimated. Testosterone production, nerve recovery, and hormonal balance are all strongly influenced by sleep quality. Chronic sleep deprivation disrupts the hypothalamic pituitary gonadal axis, which is responsible for regulating reproductive hormones. When sleep improves, hormonal signaling becomes more stable, and sexual function often follows. Stress management is equally important. The male sexual response is highly sensitive to the autonomic nervous system. When the body is in a chronic state of stress, the sympathetic nervous system dominates. This reduces parasympathetic activity, which is essential for proper sexual response and coordination. In simpler terms, the body becomes more focused on survival mode than reproductive mode. Over time, this imbalance can subtly affect ejaculation quality even when physical structures are intact. One of the most encouraging things I share with patients is that the nervous system is adaptable. It is not fixed. When stress levels decrease, when sleep improves, and when anxiety is addressed, the system often recalibrates itself. This is why some men notice fluctuations in symptoms depending on their mental state. It is not imagined. It is neurophysiology in action. Now, let's talk about something equally important: expectations during recovery. One of the biggest sources of frustration is unrealistic comparison to past function. Many men expect that if improvement happens, everything should return exactly as it was at age 25 or 30. But biological systems do not operate like static machines. They evolve. The goal of treatment is not to recreate the past, but to restore a stable, satisfying, and healthy function for the present stage of life. In practical terms, that means if ejaculation volume improves partially, but sexual satisfaction and intimacy are restored, that is still a successful outcome. If erections become more stable, energy improves, and anxiety reduces, even if minor changes in fluid output remain, the overall quality of life is significantly better than before. Medicine focuses on function and well-being, not just isolated metrics. There is also an important psychological shift that happens during recovery. Many men enter the process believing something is broken, but as understanding grows, that belief is replaced by clarity. And clarity changes behavior. Men become more willing to seek help, more open with their partners, and more engaged in their own health. This shift alone can dramatically improve intimate relationships, because silence is often more damaging than the symptom itself. Communication with a partner is another key element that cannot be ignored. In many relationships, sexual changes become a private burden carried by one person. But when it is discussed openly, without shame or fear, the emotional pressure reduces. Partners often respond with more understanding than expected. This creates a supportive environment, which in turn reduces performance anxiety and improves sexual experience naturally. From a medical standpoint, follow-up is also essential. Conditions like hormonal imbalance, metabolic disease, or medication-related effects are not static. They evolve over time. Regular monitoring allows adjustments to be made before symptoms worsen again. This is especially important in men with diabetes or cardiovascular disease, where sexual changes can sometimes act as an early indicator of broader health shifts. One more important concept that needs to be understood is that improvement is not always linear. Some men experience rapid recovery, followed by periods of fluctuation. Others improve gradually in small steps. This variability is normal and reflects the complexity of hormonal, neurological, and vascular systems working together. The key is not short-term variability, but long-term trend. As we look at the bigger picture, what becomes clear is that dry ejaculation is not a standalone identity issue, nor is it a permanent marker of aging. It is a symptom with multiple pathways, most of which are manageable once properly identified. And more importantly, it is a condition where understanding directly reduces fear, and reduced fear often improves outcomes. In my clinical experience, one of the most powerful turning points for patients is simply being told the truth in a clear, structured way. Not exaggerated reassurance and not unnecessary alarm, but honest explanation. Once men understand what is happening inside their body, the emotional weight they carry begins to lift. And that emotional relief often becomes the first real step toward physical improvement. So when we talk about recovery, we are not only talking about medication, procedures, or hormones. We are also talking about restoring confidence, reducing anxiety, improving communication, and rebuilding a sense of control over one's health. These elements together are what truly define recovery in sexual medicine. And perhaps the most important message to take from everything we have discussed across this series is this: your body is not betraying you. It is communicating with you. And when you respond with understanding instead of fear, you give yourself the best possible chance of improvement. Continuing from where we left, once a man understands the causes and recovery process of dry ejaculation, the final and perhaps most valuable question becomes this: how do you prevent further decline and protect sexual health for the long term, especially after 50 or 60, when the body naturally becomes more sensitive to hormonal, vascular, and neurological changes? The first principle of prevention is simple but often ignored. Sexual health is not separate from overall health. The same systems that control ejaculation, erection, and orgasm are deeply connected to the cardiovascular system, endocrine system, and nervous system. That means if you protect your heart, metabolism, and nerves, you are indirectly protecting your sexual function as well. Let's start with the most powerful foundation, vascular health. Blood flow is the silent driver behind almost every aspect of male sexual function. The pelvic organs depend on strong, flexible blood vessels that can respond quickly to nerve signals. When arteries become stiff due to age, smoking, high cholesterol, or diabetes, the entire system becomes less responsive. Not immediately, but gradually over years. This is why conditions like erectile changes or altered ejaculation patterns often appear as early warning signs of cardiovascular disease. Preventing this begins with consistency, not intensity. Regular physical activity, especially walking, resistance training, and light aerobic exercise, helps maintain vascular flexibility. You are not trying to become an athlete. You are trying to keep your internal plumbing responsive. Even moderate daily movement improves endothelial function, which directly supports sexual performance. Diet plays an equally important role, but not in a restrictive or extreme sense. The goal is metabolic stability. High sugar intake, processed foods, and chronic overeating gradually damage insulin sensitivity. And insulin resistance is one of the most underestimated causes of sexual dysfunction in men. It affects blood vessels, nerve signaling, and hormone balance simultaneously. On the other hand, a balanced diet, rich in whole foods, healthy fats, lean proteins, and fiber supports stable hormone production and vascular health. Another critical pillar is hormonal maintenance. Testosterone does not simply decline overnight. It usually decreases gradually over years due to a combination of aging, stress, poor sleep, and metabolic dysfunction. The mistake many men make is ignoring early symptoms like reduced energy, decreased motivation, or subtle sexual changes until they become more pronounced. Prevention here means monitoring, not guessing. Periodic blood tests after a certain age can provide valuable insight into trends before they become clinical problems. But hormones are not just about numbers on a report. They are highly sensitive to lifestyle. Sleep, in particular, is one of the most powerful natural regulators of testosterone. During deep sleep cycles, the body performs essential hormonal restoration. Chronic sleep deprivation disrupts this process, leading to gradual decline in reproductive function. Improving sleep quality is one of the most effective long-term strategies for preserving sexual health, yet it is often the most neglected. Stress management is another area where prevention becomes crucial. Modern life keeps many men in a constant state of low-grade stress. Financial pressure, work demands, health concerns, and emotional strain all activate the sympathetic nervous system. When this system remains overactive for long periods, the body prioritizes survival functions over reproductive functions. This means reduced sexual responsiveness, altered ejaculation patterns, and decreased libido over time. Techniques such as structured relaxation, breathing exercises, meditation, or simply regular downtime are not optional luxuries. They are physiological necessities for maintaining balance. The nervous system must shift between activation and recovery. Without recovery, dysfunction gradually appears. Now, an often overlooked aspect of prevention is medication awareness. Many men over 50 are on long-term medications for blood pressure, prostate enlargement, or mood disorders. These medications are often essential and life-saving, but they can also influence sexual function. This does not mean they should be stopped, but it does mean they should be regularly reviewed. Medicine is not static. What was appropriate at one stage of life may need adjustment later. Open communication with a physician allows for optimization rather than compromise. Sometimes small adjustments in dosage or timing can significantly reduce sexual side effects without affecting therapeutic benefit. The key is not to suffer in silence, but to engage in ongoing management. Another important preventive strategy is pelvic floor health. The muscles involved in ejaculation are part of a coordinated system that can weaken or become unbalanced over time. Just like any other muscle group, they respond to training and conditioning. Gentle pelvic floor exercises, when done correctly, can improve control, coordination, and overall sexual function. However, it is important that this is done with guidance, because incorrect technique can sometimes worsen tension rather than improve function. Hydration and general physical wellness also contribute more than people realize. The reproductive system depends on fluid balance and electrolyte stability. Chronic dehydration or poor nutritional intake can subtly affect glandular secretions over time. These effects are often not dramatic, but they accumulate. Beyond physical factors, there is a psychological dimension to long-term sexual health that deserves equal attention. Confidence, emotional connection, and mental well-being play a direct role in sexual response. Anxiety about performance, fear of aging, or repeated negative experiences can create a cycle where the nervous system becomes overly cautious during intimacy. This reduces natural response and increases variability in function. Breaking this cycle is not about forcing performance. It is about restoring trust in the body. Understanding how the system works reduces unnecessary fear. When fear decreases, physiological response often improves naturally. This is one of the most powerful yet least discussed aspects of sexual medicine. Relationship dynamics also play a major role. Intimacy is not purely mechanical. Emotional safety, communication, and mutual understanding significantly influence sexual experience. Men who feel supported rather than judged tend to maintain better long-term sexual function. This is not psychological theory. It is measurable in clinical outcomes. As men age, the goal should shift from performance-based thinking to health-based thinking. Instead of focusing only on intensity or frequency, the focus should be on consistency, comfort, and satisfaction. This shift in mindset alone reduces anxiety and improves overall experience. Another key aspect of prevention is early intervention. Small changes should never be ignored. A slight reduction in volume, a minor change in sensation, or occasional variability may not seem significant at first, but they often represent early signals from the body. Addressing these changes early allows for simpler solutions. Waiting too long often means dealing with more complex underlying factors. It is also important to understand that aging does not mean decline in a linear or unavoidable way. Many men maintain strong sexual health well into older age when they actively manage their health. The difference is not just genetics. It is lifestyle, awareness, and timely medical care. Finally, the most important message I want you to take from this entire discussion is this. Sexual health is a reflection of systemic health. When the body is supported, the system performs. When the body is neglected, symptoms appear first in sensitive systems like sexual function. That is why these changes should not be viewed with shame or fear, but with attention and responsibility. Dry ejaculation, altered sensation, or changes in sexual response are not the end point of masculinity or vitality. They are signals that the body is asking for evaluation, balance, and sometimes simple correction. When addressed properly, many men not only regain function, but also improve their overall health trajectory. So prevention is not about avoiding aging. It is about aging with awareness, stability, and control. It is about staying engaged with your body rather than disconnected from it. And most importantly, it is about understanding that even after 50 or 60, your health is still actively shaped by the choices you make today. Continuing from where we left, the final piece of this entire discussion is not another medical explanation or another treatment pathway. It is perspective. Because after understanding the causes, the mechanisms, the diagnostics, the recovery options, and the prevention strategies, what ultimately determines a man's experience is how he interprets what is happening inside his own body. Let's be very clear about something that often gets lost in silence and fear. Sexual function is not a fixed asset that you either have or lose. It is a dynamic system. It responds to hormones, nerves, blood flow, sleep, stress, medication, and emotional state. That means variation is not only possible, it is expected. The problem begins when variation is mistaken for permanent failure. When a man experiences dry ejaculation or reduced fluid output, the immediate emotional reaction is often far more intense than the physical change itself. The mind quickly connects it to aging, decline, or loss of identity. But medically, what we see is something very different. We see systems adjusting, not collapsing. We see signals changing, not shutting down, and most importantly, we see treatable or manageable factors in the vast majority of cases. This distinction matters because fear amplifies symptoms. Anxiety tightens muscles, disrupts nerve signaling, and alters hormonal balance. In other words, the emotional response can sometimes worsen the very symptom that caused the concern in the first place. That is why reassurance is not just psychological comfort, it is physiological correction. Over the course of clinical practice, one of the most consistent patterns observed is this. Men who understand their condition clearly tend to recover better, adapt better, and report higher satisfaction even when complete reversal is not possible. Knowledge changes behavior, and behavior changes outcome. Now, let's bring everything together in a practical sense. If a man notices this change, the correct response is not panic and not denial, but structured action. First, observation without exaggeration. Second, medical evaluation without delay if symptoms persist or worsen. Third, review of medications, metabolic health, and hormonal status. And fourth, lifestyle stabilization focused on sleep, movement, stress control, and cardiovascular health. These steps are not complicated, but they are often delayed because of embarrassment or misunderstanding. And that delay is what allows anxiety to grow unnecessarily. There is also something important to understand about the nature of masculinity and health. Strength is not defined by the absence of change. Strength is defined by the ability to respond correctly to change. A man who notices a shift in his body, seeks understanding, and takes appropriate action is not experiencing decline in masculinity. He is demonstrating control over his health. It is also essential to address one final misconception directly. Many men equate ejaculatory volume with sexual capability or fertility alone. While fluid output does play a role in reproduction, sexual satisfaction, intimacy, and function are not defined by volume alone. Orgasmic sensation, erectile quality, emotional connection, and overall vitality are far more comprehensive indicators of sexual health. This is why modern urology does not focus on a single metric. It evaluates the entire system. Because the goal is not just mechanical output, but quality of life. In long-term outcomes, what matters most is not whether every parameter remains identical to earlier decades, but whether a man maintains a satisfying, confident, and healthy, intimate life. That is achievable for most men, even with age-related changes when underlying factors are properly managed. There is also hope that many men do not initially recognize. The male body has significant adaptability. Even when one pathway is partially affected, other pathways often compensate. Nerve plasticity, hormonal adjustment, and vascular adaptation all contribute to maintaining function over time. This is why outcomes are often better than initial fear suggests. And perhaps the most important message in this entire discussion is this: silence is the biggest barrier to recovery. Not the condition itself, not the diagnosis, but the hesitation to speak, to ask, and to seek clarity. Once that barrier is removed, solutions become visible very quickly. A man does not lose control when his body changes. He loses control when he stops understanding it. The moment understanding returns, control returns with it. So if you are experiencing this, or if someone you know is quietly dealing with it, the correct approach is simple. Do not assume the worst. Do not ignore the signs. Do not internalize unnecessary shame. Instead, approach it like any other medical signal the body provides, with attention, clarity, and proper evaluation. Because in the majority of cases, what feels like a serious loss is actually a manageable condition with identifiable causes and real solutions. And in many cases, improvement is not only possible, it is expected when the right steps are taken. In the end, sexual health is not just about physiology. It is about confidence, connection, and overall well-being. And all of these are deeply interconnected with the rest of your health, your habits, and your mindset. So the final takeaway is simple. Your body is not turning against you. It is communicating with you. And when you learn to listen correctly, respond appropriately, and act without fear, you give yourself the best possible chance not just to recover function, but to maintain a stable and confident quality of life moving forward. This concludes the full series.